So we were just talking about why we get more cavities as we age, which seems so unfair, doesn't it? But I want to talk for a few minutes about strategies that we can use in order to avoid that pitfall and all the expense and pain that comes with it. So we were talking about having a dry mouth and more nooks and crannies, or areas where plaque and food can accumulate as we age. And so one of the first things that I want to point out is that we have to be extra diligent about getting everything super duper clean, getting that bacteria off of our teeth after every meal. And I highly recommend a water pick on full blast once your gums can tolerate it, and getting in around all those little nooks and crannies. Just get it all cleaned out, because then the bacteria can't eat the food and make the acid that causes your cavities. The next one is to talk to your dentist about different special medications that you can use, rinses and toothpaste, and that'll be between you and your dentist which ones you choose, but ones that are extra protective, not just your average toothpaste and mouthwash from the drugstore, but the ones that your dentist recommend for you. The next one has to do with your diet, because you know what happens as we age is it's harder to swallow, and our daily living is simplifying, and we have a tendency to eat foods that have become more processed over time. And that's really good for the bacteria that like to make cavities in your mouth. So finding foods that are closer to how nature made them protects your teeth, and then also making sure it's a variety of hardness. So you want to eat some crunchy stuff, like vegetables and nuts and things like that, because the soft breads and soft crackers and stuff, they'll go right up into there in those nooks and crannies and stay until you have a cavity.